Inadequate health care is one of the many challenges women in Africa contend with in their daily lives. Now, despite its prevalence in the continent, polycystic ovary syndrome is one health issue that threatens the well-being of women due to improper diagnosis and treatment. With the help of social media platforms, individuals are now spreading the message about this health condition using personal experiences and tips, curbing stigmas surrounding reproductive health issues and creating educative communities among women. News Centre's Adesewa Odusoga reports.
Polycystic ovary syndrome is the most common gynecological endocrine disorder in Africa, affecting women of reproductive age. But this condition is underdiagnosed and undertreated, particularly among Black women, despite contributing largely to the infertility rate. At least 1 in 6 women in Nigeria is living with PCOS, but there is still limited awareness, mostly for the fear of stigmatization.
It has a genetic predisposition, but you cannot say this is the exact cause. Okay, it can be familial. Familial means it can run in families. There's a genetic predisposition. You cannot say this is the exact cause for it. There could be associations. When I mean association, or family history of polycystic ovarian syndrome, body mass index and things like that, but you cannot say this is what the cause. And there are so many conditions in gynecology that are like that.
Nzala Zamani is a 30-year-old epidemiologist who has been living with PCOS for more than a decade. She started advocacy with a social media platform to bridge the knowledge gap in Nigeria.
We are in Africa, and one of the main things that could make you an object of ridicule is from the fact that you cannot give birth to children. So one of the main notions about PCOS that a lot of people know is the fertility aspect. Meanwhile, the fertility aspect is just one of plenty, because as a woman with PCOS, you can get down with other disease conditions, right? And so the internet, the world around us starts to shame women who cannot give birth because they have PCOS.
PCOS happens when the ovaries are filled with cysts instead of eggs or normal follicles. One of the symptoms include irregular periods or no periods at all, infertility, excessive body hair growth, weight gain, and hair loss from the head, amongst others.
You don't just sit and because you've lost your period for a couple of months, or because you are gaining weight, you say, oh no, you have PCOS. No, you'd have to do your blood work first. You'd have to do a couple of ultrasounds. It could be transvaginal ultrasound, it could be an abdominal scan. And then a gynecologist now says, okay, according to what they have done, you have PCOS.
Growing evidence shows that infectious and non-infectious diseases in Africa may be linked to polycystic ovarian syndrome, affecting the quality of health of girls and women in Africa. There is, however, a need for the government and concerned bodies to bridge the knowledge gap, as many women living with PCOS are yet to get diagnosed, let alone manage the condition, which is fast becoming a threat to reproduction. Adesewa Odusoga reporting for News Central.